Hi, I am Prashanth R Reddy. I am an ENT and endoscopic sinus skull surgeon. I practice in various hospitals across Bangalore. So, snoring is not a healthy sign. Many of us assume that snoring is a sign of being healthy. Unfortunately, no. So, snoring is not a healthy sign, it's a pathological sign because snoring occurs secondary to the vibration of the structures in your throat and in your oral cavity. Snoring leads to a lot of pathological issues like patients will develop diabetes, patients will develop hypertension. Secondary to these two, they develop heart issues and also they'll develop stroke. Many a time patients who suffer with snoring tend to have daytime sleepiness. When they are working on something, they feel very lethargic. They don't feel like waking up in the morning because they have not got good deep amount of sleep. They also complain of multiple issues like various types of pains across the body. All this occurs secondary to snoring. Snoring leads to increased amount of stress hormones in the body, which is nothing but your steroid levels in your body will go high. Secondary to the snoring being there, the patients will develop various types of complications of diabetes and hypertension. Snoring leads to patients having more amount of weight gain, and that in turn leads to a lot of other comorbidities secondary to obesity. So snoring is not good. Kindly consult your ENT surgeons, your pulmonologist to ensure that you have a sound sleep and also people around you can sleep better because snoring hampers their sleep as well. Many people have issues of sleep disorders, like they'll have insomnia at night times, they cough and they wake up, and you would have observed a patient or a person who's snoring, especially if your partner, they tend to not sleep sound. They'll keep tossing around, they'll make a loud noise that will disturb your own sleep, and also even though they would have slept the entire night, when the morning when they wake up, they have that grogginess or the lethargy which is always present. This is secondary to the improper oxygenation. The oxygen in the blood will dip down when you are snoring. Many people think and assume snoring is healthy. It's a sign of a person being very healthy or person sleeping very deeply. No, unfortunately not. Snoring is not a sign of healthiness, or it's a very pathological sign of someone who's actually suffering from something called as sleep apnea, more so called obstructive sleep apnea. So what is obstructive sleep apnea? Obstructive sleep apnea occurs when the breathing cesses, or the cessation of breathing or stopping of breathing when you are sleeping. This occurs secondary to the obstruction of the nose. Secondary to the obstruction of the nose, when your person is sleeping, they tend to open the mouth and breathe. Secondary to the mouth being open and breathing, the tongue will fall backward. Secondary to tongue falling backward, the whole area in the mouth becomes dry, secondary to mouth breathing. So whenever the mouth gets dry, there's more amount of blood which gets pushed to the tissues, soft tissues, which will get enlarged in size. The soft tissue being your tongue, the palate, that secondary leads to further worsening of the obstruction, and that also leads to snoring. Because of the obstruction in the night time, the amount of oxygenation of the blood is low. Secondary to the oxygenation of the blood being low, the whole body suffers. The muscles will have muscle cramps secondary to the buildup of lactic acid because there's no proper circulation happening and there's no oxygen flowing into muscles. The brain doesn't get sufficient oxygen, so the sleep is disturbed and they'll have choking episodes because of the breathing difficulty. Suddenly they'll wake up for a few microseconds, adjust the tongue, again go back to sleep. So because of this wake and sleep cycle which keeps disturbing the sleep, that leads to improper sleep, and the persons will have major issues in the daytime leading to sleepiness in the daytime. Because of all these factors, the stress hormone levels in the body will be extremely high. This leads to patients developing diabetes and hypertension, and patients who ever develop diabetes and hypertension will have a variety of other complications which can occur, like heart failure, like brain stroke and other issues. Many people also will have impotence because of snoring. Many of the patients are not going to get treated for impotency thinking that it is something related to their issues, but it's actually correlated to snoring. Because patients snore, their impotency will also occur. So these are the various complications which can occur with snoring.